Hello, thanks for joining this call and this webinar. My name is Heidi Sveistrup. I'm the Vice President Research at Bruyère and the CEO of the Research Institute that we have at Bruyère. And I'm absolutely thrilled to, very pleased to launch this webinar series, Bruyère Talks Research. And especially this one that we're doing, it's the first one that we're holding, and it's in collaboration with our Global Health Research Unit. It's an amazing, strong group of scientists who are doing work locally, regionally, nationally, and internationally. And they've come together today to give you some information from their work, but also work of experts across the world. So I'd like to introduce Dr. Alison Krenchel, who's an investigator with us at Bruyère and an assistant professor at the University of Ottawa in the School of Epidemiology and Public Health. Dr. Krenchel.
Thank you very much. Welcome, everyone. I'm delighted to be able to launch this series with a very timely subject matter. So the title of our meeting today is Ensuring a Balanced Multi-Sectoral Response to COVID-19. And we're going to be looking at examples from Ghana, Costa Rica, and Canada. Next slide, please. So just to kind of start us off, I'm sure that pretty much all of the nearly 120 participants enrolled in this webinar today will be very familiar with the Johns Hopkins webpage. And we've all, I think, well, I certainly have gone to it regularly to look at my own country, to look at countries I visited, countries I care about, countries where friends are living, to see what the current situation is. And I think this has been a tremendous resource as we have watched the movement of the coronavirus since the beginning of January across the world to pretty much every country. So this is today's statistics taken from this morning. And the three countries we're going to be looking at today represent three very different pictures. And we look at Canada with over 98,000 confirmed cases, Ghana over 10,000 confirmed cases, and Costa Rica just shy of 1,500 cases since with the data recording that's there. So we're going to be looking at three very different countries and understanding their response to this global pandemic. Next slide, please. So just a quick overview. We're going to start our discussion today with Professor Mintzberg, who's going to give us an introduction of a framework that combines the private, public, and plural sectors as a way for us to look at the different national responses to COVID-19. As each of our speakers talk, you'll hear about different variations on the way that countries have responded to the pandemic. There'll be cross-cutting themes, there'll be differences, and we'll also have some challenges that are highlighted as we look to the future, potential second waves, and how do we plan for those and anticipate the challenges that are before us. So I think it's going to be a really interesting discussion today, and I'm glad that everyone is on board. Next slide, please. So how this session will work, each of our panelists will have 10 minutes to present their slides, and then we'll have some time for a moderated discussion at the end of the speaker's remarks. So there are comments that can be made in the chat box, so please do record your questions. I will be collating them and bringing them to the panel at the end of our discussion. If there's a specific panelist you'd like to address the question to, please do indicate who that person is, and I will ensure that, well, I'll do my best, and hopefully we'll have enough time to cover as many of those as possible. Next slide, please. So before we move forward, I'm just going to introduce each of our speakers, and we kind of agreed as a panel I'd introduce everybody now, and then we'll just call on speakers as we go forward. So I'm introducing them in the order that they'll be appearing. So Professor Henry Mintzberg, who's the Cleghorn Professor of Management Studies at McGill University. And you can see the breadth of experience that Professor Mintzberg has had the multiple honorary degrees, and his co-founding of the International Masters for Health Leadership Program. So we really look forward to his remarks this morning and the introduction of the framework that he is going to bring to us. We have Professor Margaret Gyapong, who's a professor at the University of Health and Allied Sciences in Ghana in the Volta region. Professor Gyapong is an expert in medical anthropology and cultural epidemiology, and has a PhD from the University of Basel. She is a longtime colleague of mine, and I'm looking forward to hearing her discussion about how Ghana has reacted to COVID-19. We have Professor Carol Vlassoff, who is a professor at the School of Epidemiology and Public Health here at the University of Ottawa, and an investigator with the Bruyère Research Institute. Professor Vlassoff is a world expert in gender and has worked for many years at the World Health Organization, and will really be able to, she's had her feet in two worlds, living between Costa Rica and Canada, so will provide a unique perspective from her experiences in Costa Rica. And finally, Professor Janet Hatcher-Roberts, who's an adjunct professor at the School of Epidemiology and Public Health at the University of Ottawa, and also a scientist at the Bruyère Research Institute. Ms. Hatcher-Roberts has had many, many years of experience in the international and global health work, working for large multilateral UN organizations. So she has a specific expertise in equity and effectiveness and strengthening health systems. So we look forward to hearing from her and her perspective on Canada. So I will stop talking. Welcome to each of our esteemed panelists, and really look forward to hearing from you as you lead us through your slides. So we'll call on Henry first. Thank you.
Thank you, Alison. I did a book in 2015 called Rebalancing Society, and it's actually available on my website, mintzberg.org, as a PDF, thanks to a very generous publisher who let it go that way too. I thought I'd take this opportunity. I've been promoting this idea that societies are out of balance and we need to bring them back into balance. I've been doing that for some years, and I always wanted to do some kind of prop to show it rather than PowerPoints for a change. So I'm using this opportunity to show you kind of what I want to say. And it may be a bit awkward, but let's try it and see. Just the first 2-3 minutes. So the point I want to start with is you cannot balance a stool on one leg. You can't balance a table on one leg. You can't balance a stool on one leg. And so I've sort of concocted this morning, and you can see it's sitting on a red leg, my point is that whether the leg is red or green or blue, it doesn't make a difference. You can't balance it on one leg. And I'll tell you why I'm using red, green, and blue in a minute. You can't balance it on two legs. And I could put, I can sort of put two legs underneath. One leg makes it completely unstable. Two legs makes it very wobbly, and three legs is necessary for balancing a society, balancing a stool. And the same thing applies to balancing a society. One leg, the red leg, stands for the public sector, stands for government. And you can't build a whole society based on the power of government. The communist countries tried to do that and it collapsed. You can't balance a society on the leg of the private sector, which has been happening ever since 1989 in the United States and Britain especially, but all over the world. In other words, when the Berlin Wall collapsed in 1989, the assumption was that capitalism had triumphed. I didn't believe that at all. Capitalism didn't triumph at all in 1989, communism collapsed. And communism collapsed because it was out of balance, because all the power in the communist countries was in the public sector. But the belief that capitalism has triumphed has been enabling capitalism to triumph ever since. And what we've been seeing is going out of balance in our Western countries that used to be much more democratic, and particularly the UK and the US have been going out of balance on the side of their private sectors. So we need to introduce what I call the plural sector. The plural sector is essentially the community sector. If the private sector is the business sector and the public sector is the government sector, then what I call the plural sector is the community sector. And I call it plural because it consists of a huge variety of organizations. People are always confused when I talk about the plural sector. So let me just say a word, what it's not. It's not government-owned organizations. It's not investor-owned organizations. It's organizations that are either owned by their members, like co-ops, Van City and Desjardins Quebec and Mountain Equipment Co-op, or it's owned by nobody. And people are always confused when I say, what does it mean that an organization is owned by nobody? Well, Bruyère is owned by nobody. McGill is owned by nobody. Greenpeace is owned by nobody. Doctors Without Borders is owned by nobody. We have an enormous number of organizations that are owned by nobody, and they make up the plural sector. Plus all the social kind of movements and social protests and social initiatives that we have so many of in society, enormous numbers of these. Just look what's happening right now, especially in the US, but elsewhere with Black Lives Matter. These are community movements. So the community sector, the plural sector, is huge, but it's obscure. We think public and private. We bounce back and forth between public and private, as we've been doing for many years. So what I call pendulum politics. We swing back and forth between left and right, public and private, and it's unstable. And so we need to recognize the plural sector for the sake of stability. In other words, a healthy society, like a balanced stool, sits on three legs. It sits on a private sector leg, a public sector leg, and a plural sector leg. And I call it plural so people will see that it goes along with public and private. And if you look at the pandemic, it seems to me that the countries that are doing the best, for the most part, are balanced across those sectors, whether it's Denmark or New Zealand, I think Canada to some extent, certainly Germany. Those countries are rather balanced. The three countries that are right now doing horribly, the United States, the United Kingdom, and Brazil, are all being run by people who are totally private sector oriented and governments that are totally private sector oriented and completely out of balance, to my mind. So balance becomes a kind of issue across sectors, both for the pandemic and pre and post pandemic. Maybe I'll stop there. I don't know if that's 10 minutes, but I think it should be okay.
Thank you very much, Henry. I think you've outlined for us an excellent framework as we move forward. And I think there'll be lots of questions after we've looked at the country examples to come back to you and see how each of these table legs has been balanced or unbalanced in the examples that we're going to hear from. So thank you very much. And I'd like to invite Margaret, please, to turn on her camera, and we'll look forward to hearing from her as she outlines the story in Ghana. So if you can advance the slide, and hopefully we'll bring Margaret up here. Great. Welcome, Margaret.
Thank you. Thank you very much, Alison and Henry. I've learned something about groups and societies that are not owned by anyone. In medical anthropology, you talk about plural health systems, and it's everything mixed up in one. I guess it's the background is about the same. So I'm asking a question, and at the end of the presentation, I'll leave the question to all of us to answer. The question is, if we do something right, and I'm looking at a multi-sectoral approach to dealing with COVID-19 in Ghana. Ghana, Anglophone West Africa, population of about 30 million, 44% rural population, and about 79% adult literacy rate. Next slide, please. Next slide. Okay, thank you. So I had Alison talk. No, previous one, please. Previous slide. Yeah, thank you. So I heard Alison talk about her checking on the cases as at this morning, and this is what we have on the official website of the Ghana Health Service. We have, as at this morning, 10,358 cases, with a little over maybe almost 4,000 recoveries and 48 deaths. And you can see from the map that most of our cases are hovering around the middle and the southern parts of the country. I really don't know why, but most of the areas that have the highest number of cases are capital towns. So you have huge populations, people moving from all over the place to these cities for economic reasons. And then you find up the northern part of the country towards the west, having fewer cases of the disease. Next slide, please.
Okay.
So if you look at this slide, you notice that of the numbers that we have reported, a lot of testing has happened. And most of the testing has been done through contact tracing. So of the over 10,000 cases, positive cases that we have found, we have done over 240 tests. Most of the testing has been done through contact tracing. You identify somebody who has the symptoms and then you trace along the line. And a few people have been quarantined on a mandatory basis. The positivity rate is about 4%. So it gives people the feel that COVID is not so much of a big problem in Ghana. In the beginning, people were scared and kept to themselves and did not go anywhere. But if you walk on the streets today, you find people going about business as usual, and sometimes it's a source of worry. Next slide, please. So what did the government do, or what has government done to date? Since our first case was reported on the 12th of March, we've been having weekly briefings from the Ministry of Information and 10 presidential addresses between March 15th and May 31st. And whenever we hear that the president is going to speak, everybody goes to say, he's going to say, fellow Ghanaians, I've come into your homes again this evening to provide an update, as I promised, on the measures taken by government to combat the coronavirus pandemic. And then people are all ears to listen. But the interesting thing is that he's been very consistent with giving out information and progress and plans that the country is putting in place. Next slide, please. So what have the mechanisms been? As I said earlier on, there has been a high level of elevated coordination from the office of the president, and he has taken the lead in holding meetings and bringing stakeholders together to discuss what the issues are and what the steps that need to be taken are. It's a whole government approach, multiple sectors, multiple disciplines, and the structures are at all levels of the country, from the national right down to the district level. And then even at the district level, a lot of activities are decentralized. So you have coordinating committees, you have public health emergency committees, you have rapid response teams, and everybody is on high alert, making sure that things are done in the right way. So you find all kinds of sectors working together, bringing their expertise on board to be able to address this simple problem, a disease, but ending up being a developmental issue as well. Next slide. Yes. So we have the presidency at the top, and we have the Ministry of Health and the Ghana Health Service, where credible information is supposed to come from. So in the beginning, different people were reporting figures, but now we need to go just to the Ghana Health Service website to be able to pick up information. You have the Ministry of Information giving out regular credible information. And then you have our research and academic institutions who just stood up and decided to take control of the situation, if I should say, when it came to testing. So a lot of the testing right at the beginning was done by the research and academic institutions. And now you have our public health reference labs who are coming on board. You had Ministry of Education because schools were shut down. And so the ministry had to lay down measures as to what should be done. Ministry of Chieftaincy and Religious Affairs. And if you know Ghana, we don't joke with our religion, and our church service and our chieftaincy and our cultural issues are of great importance. So we needed to have the chiefs and other members on board. The Ministry of Finance, because of various packages that were going to be offered to people, and Ministry of Foreign Affairs and Interior, because of the closure of the borders. So all these ministries coming together, holding daily briefings and meetings to be able to address the simple problem. Next slide, please. So there were five main strategies that the government put in place. The first one is to limit and stop the importation of cases, and that's where we had the border closures. Flights were suspended. In fact, we don't have any flights coming in anymore. And then the quarantining and testing of arriving travelers in the early stages. The second one was detection and containing of cases, and that's where all the suspension of public gatherings and enforcement of social distancing, locking down of various areas, and wearing of masks in public places was introduced. So now you go into various places and you are told no mask, no entry. Next, please. And with these measures, we had major problems because of our funerals and our big markets and the crowds that gather in these places. And with the lockdown and social distancing, it was a bit difficult sometimes to be able to enforce some of these things. And there was a huge outcry about how people could sustain their lives with all these mitigating measures and strategies that had been put in place in the country. It wasn't that easy at all. Next slide. Next, yeah. So the third measure was taking care of the sick, care in treatment facilities. So treatment facilities and isolation centers had been put in place. And then looking at the impact on social life. So various soft loans and rebates were given for electricity and water bills so that it could cushion people in all these times of difficulty. If we are saying people should wash their hands regularly, then you needed to give them some relief from water bills and stuff like that. And then also the domestic capability to be self-reliant. So we found out that because the borders were closed, we couldn't import masks, we couldn't import sanitizers. And so a lot of local industry started producing these items, and it made Ghanaians aware of the fact that they were capable of doing things on their own. Next slide, please. Then the whole multi-sectoral approach, like I talked about, so various briefings, you had the public-private partnership, the churches were brought on board to make available their rooms. The football associations were not operating, their halls and their pitches were made available. And then the local private sector started manufacturing the PPEs and the sanitizers to be able to make sure that these things were not in short supply. And there were very interesting innovations, and people's capacities were brought to the fore. We had our drones delivering samples to testing centers because our road network was bad. And sometimes by the time the samples arrived in a testing facility, they were destroyed. And so we had drones delivering them quickly to some of these testing centers to ease the burden on the few testing centers that were around. And then you had the sequencing of the COVID-19 virus undertaken by Ghanaian scientists on their own, the Noguchi Memorial Institute for Medical Research. You had a private organization who has developed rapid tests, and those are in the process of being checked to make sure that things are okay with them. And then the enhanced testing strategy. So all these measures were put in place. Next slide. I think we can skip this one because my time is almost up. Yeah, let's skip this slide. Oh, this takes a long time. So there are several challenges that we face despite all the measures that were put in place. Illegal entries and propagation of false news, fake news, people breaching the social distancing, a lot of stigmatization, which created a problem in the country. But then the country is trying to continue with the education and identify more isolation and quarantine centers to be able to handle the increasing number of cases. Last slide, please. So what have I been saying? Basically, from day one up to today, our numbers have increased. And it appears as if we've put in a lot of measures in the first month in the hope that we'll be able to contain the conditions, but the numbers have kept increasing. The question is, did we do something right? I'll leave it up to you. Thank you very much for your attention.
Thank you, Margaret. That was really very interesting, and I think we could have spent a lot of time. And I think seeing the scenes of a market in Ghana makes us aware of the very different places that that measures are being taken, and one size does not fit all. So thank you very much for the occasion. I look forward to the discussion at the end. So next, I'd like to call Carol, who's here, to give us an overview of the Costa Rican experience. Thanks, Carol.
Thank you, Alison. Well, in the introduction, you mentioned that I share part of my time with Canada and Costa Rica, and so I won't need to talk too much about that. However, I was in Costa Rica at the time when the COVID-19 outbreak occurred. And I was able to witness firsthand how the country responded. For this brief presentation, I'm going to use Henry's framework regarding the important balance of the stool legs, the public, private, and plural sectors that make a society work well. And I'm hoping that Henry will add Costa Rica, and I would say probably Ghana, to his list of countries that are doing quite well. In the COVID response, I do feel that Costa Rica has managed the balance. However, there are still some challenges. So the first slide is a quote from a Latin American report on May the 11th, noting that the ticos, which is the affectionate term by which Costa Ricans are known, have excelled over other countries in Latin America and the Caribbean region, including neighboring Panama, which has done a lot more testing. In 1949, Costa Rica abolished the armed forces in favor of public goods, especially health, education, and social welfare. And the health functions are shared. It's a very unusual situation because it's shared by the Ministry of Health, which has the governance functions. And you see the Minister of Health up to the left, along with the President, Carlos Alvarado, on the right. And the other arm is the Social Security Department, which does service delivery for health and social services both. Next slide. So here you see the epidemiological indicators. I have to say that in the slide, the epidemiological indicators above are only up to the date of May the 12th. However, the curve remains similar, except for one difference that I'll talk about later, and that is with regard to the total number of cases, which has changed. What is important to note, however, is the red downward curve of active cases and the steadily upward curve of recovered cases in blue. And look at the bottom, the black line, which is deaths to date. It remains extremely low. To date, Costa Rica has only 12 deaths due to the virus, and today was the 12th one was added. Next slide. Costa Rica had its first case on March the 6th and immediately took ownership. It began screening at the airport and prepared isolation facilities there. So anyone with symptoms was isolated immediately. Having excellent relations with the Chinese embassy, it quickly got in touch with Wuhan authorities to learn what they had done to control the virus in Wuhan. It collaborated closely with WHO and PAHO, Pan American Health Organization, on guidelines, which they followed very closely. They prepared public hospitals and converted a rehabilitation hospital for COVID-19, although they haven't had to use it to its full extent for COVID-19. And they prepared the existing sentinel sites for dealing with COVID-19, as well as other ongoing routine diseases like dengue and malaria, although malaria is very low. And they've also made a mobile hospital for COVID-19, non-COVID-19 conditions, so that people who, especially for rural and outlying areas, so that the other conditions could be looked after at the same time, because they were so concerned that the hospitals would be overrun by COVID cases. Testing was limited to people with symptoms and at sentinel sites, and all contacts were traced. So today there's still, as far as I know, still no community transmission, and all cases have been able to source all the cases. Positive patients were treated at home, which managed to keep the hospitalization and ICU rates extremely low. And there were daily high-level multi-sectoral press conferences. You can see an example up to the right. And the third person who I hadn't introduced in that group is the executive director of the Social Security Agency. And that's the one that works hand in hand with the Ministry of Health. So these multilateral press conferences give updates, simple, consistent messages, and respectful reporting of people who have died. So every time there's a death, the person is not identified by name, but certainly the characteristics of the person is in a very respectful way, not simply a number. There's always consistent and transparent policy advice. Always the same thing: social distance, stay home, wash your hands, don't touch your face. And this is mainly all self-enforced, in fact. But there are additional traffic restrictions, which are restricted by license plate numbers. Days and times are cut down to cut down on circulation and social activities, including going to the beach, and the beaches have been closed, as well as most national parks. There were border closures very early on for international travel. Online schooling, which even works in the rural areas because computers were made available for the kids who didn't have them. And multi-sectoral engagement along the lines of what Margaret showed are very, very strong as well. And every day someone will come on the press conference from one of these agencies, including, for instance, public safety, education, justice, and women's and children's affairs because of the issue of domestic violence, which was thought to increase everywhere when people are at home all the time. Next slide. The private sector, the business supply chain was overseen by the Social Security Agency. Essential businesses and services stayed open. Really, there was no overall shutdown, but there was a lot of decrease in hours and ways that people did the services. Local manufacturing was encouraged. Costa Rica, the president of Costa Rica and WHO launched a landmark COVID-19 technology access pool, which is to allow all countries access to any new technology that is developed for COVID-19. And to date, I know this is signed by at least 30 countries. Test kits are used strategically and limited to those with symptoms and in sentinel sites. There's adequate protective equipment for health workers. They're always concerned that they will run out, but to date, no problem. Hospitals and ICUs are well equipped with medicines and respirators. This protective equipment is shared for the public, and an initiative by the post office was to supply the disinfectant gels to anyone who needed it, and you can just go online and order them. And in the shops, you could get non-surgical masks and gloves. Plane loads of equipment were donated, at least by 2 countries that I know of, Honduras and China. And these were very closely scrutinized at these daily press conferences and by the public in order to make sure there was no corruption. And there were contributions of local enterprises like Toyota Rent-A-Car, which gave their cars free for use to health workers. Uber gave them free rides, and grocery stores had special hours for seniors, as in many other countries. Next slide. So going back to that initial quote in the same article, with explaining why Costa Rica has done so well, they say, the one constant for Costa Rica is Costa Ricans. Los ticos have mostly abided by the stay-at-home and other lockdown orders from President Carlos Alvarado's government. And every day about noon, they turn on a TV to listen to one official in particular, Costa Rica's health minister, Dr. Daniel Salas, who has actually become a bit of a rock star, or maybe the Bonnie Henry for those who know the Canadian situation of Costa Rica. There's been pretty much adherence to stay-at-home, social distancing, hand washing, it seems, and traffic restrictions, but these are enforced by fines, so very severe fines. Voluntary engagement of the public in mask making, several things have sprung up. Fundraising for food and deliveries, especially to poor areas or people who have lost their jobs. Support to small business, such as home deliveries of flowers and other, home deliveries of flowers and other products. For example, a lot of products suffered because people couldn't go out, like fresh flowers. So some of these sprung up where they would deliver. People in condominiums would organize orders to the condo, for example. And social media messaging by youth. We see to the left a young woman who has a special Facebook page on encouraging youth not to take the COVID-19 seriously, the things they can do and how they really need to protect their loved ones as well. And engagement of many other of the plural society, including university researchers and many research activities. And anyone who's been to San Jose will look up at the right-hand picture, which shows a very busy street in the city, in the capital, and you can see that it's almost empty, which you just never ever see. So that's how closely people are adhering to the restrictions. Next slide. So of course, there are always ongoing challenges, protecting achievements. So far, no community transmission. The economic downturn, you can imagine the impact on tourism, which accounts for about 7% of GDP. Trade, of course, is affected. But the most recent issue has come up with border issues with truckers coming across the border from Nicaragua. In Nicaragua, there's really, the president has taken no notice of the epidemic, total denial. And so people are suffering terribly, really terribly. And so truckers, 50 truck workers tested positive at the border because Costa Rica introduced testing. And on that basis, they stopped people coming in, they stopped the truckers, which ended up in a line of about 22 kilometers long on both sides of the border, because the Nicaragua president also imposed it on Costa Rican people coming through Costa Rica. So the truckers were living in these really difficult situations, spending nights in a really difficult area with mosquitoes and spiders and all kinds of wildlife and limited water and food. And so really it needed to be settled, which was done finally by the agreement of the Central American countries, whereby truckers without symptoms were allowed in, but subject to strict sanitary measures. But nonetheless, the cases have spiraled, and lockdowns are now in place, especially in the north from which these truckers are coming in. So the number of cases in the graph I showed earlier, the top line, will show a spike now for sure. But fortunately, deaths remain low. So things are going well. As the Minister of Health always reminds everyone, they are walking on eggshells, but they are really managing to balance the three sectors. And I would say an overall very impressive response to the challenges of COVID-19. Thank you.
Thank you very much, Carol. And I'm just imagining standing in a 22-kilometer line traffic jam. So that has a real visual image. So thank you very much for that introduction of Costa Rica and how they have been reacting to COVID-19 and doing quite well based on what we've learned. So now I'd like to turn to Janet Hatcher-Roberts, who will be talking about the Canadian situation. So Jan, I will hand over to you. Thank you.
Thanks a lot, Alison, and thank you to Henry, Carol, and Margaret and the Bruyère Research Institute for facilitating this webinar. It's been very useful and hopeful to hear everybody's perspectives in a time of a bit of a free fall. And recognizing the interplay that Henry suggests in terms of public, private, and plural society is something I think we in the health and development field deal with on a daily basis, but not without its tensions and challenges. And I think COVID has just emphasized some of these issues and the need for balance. And we have in flux this global understanding of what's going on, the sharing of information and supplies, transparency and trust, and it's all in flux. And we are seeing where existing inequities have become and should define the way we proceed. Next slide. So making sense of the power and interaction of the public, private, and plural civil society for those of us working in health system strengthening, I think requires an appreciation of the complexity of the systems. And I think everybody's mentioned this in terms of we're not really just dealing with the healthcare system or not just the health system, but the interaction with all those other systems, whether it's education, transportation, agriculture, etc., but also the necessity to integrate a human rights framework into how we make decisions all the time, but in particular going forward with the public, private, and plural society. So the AAAQ framework that's been put forward by human rights advocates, affordability, accessibility, availability, and quality, which sounds very much like our Canada Health Act, is very important to keep in mind. The traditional roles and interplay of production of materials, delivery of services, community action, and advocacy have become even more complex during this COVID time. And the lines, I feel, sometimes are getting a bit blurred, but they're still being mutually supportive, which is a good thing. So we've seen the private sector, which has been in support of globalization and global market production, left in a bit of a deficit and our ability for surge capacity for supplies. And we've had to move to open market bidding. And the private sector, though, has been retooling, and now it seems to be a bit more effective in providing those supplies. Next slide. So for those of you not from Canada, very quickly, health is a provincial jurisdiction according to our constitution. We have universal health care coverage, which covers for costs related in hospitals, ambulatory and institutionally based rehab. Most hospitals are private entities, and we have quite a variation in our pharma coverage, but pretty good coverage for those over 65. We have a mix of coverage for private and long-term care, and I bring this up because of the disaster that's been happening in Canada. And surprisingly, not always, or maybe it's not surprising, the private sector is not always doing better. The federal system here in Canada, without evoking the Emergency Measures Act, has allowed provinces to be advised by the federal public health experts and other experts, as well as their provincial experts, but have also been able to act independently, but also collectively, and more than not, again, not with along party lines or political lines, which has been very encouraging. And the private sector stepped up and retooled. Auto industries are producing masks and visors. There's gowns and ventilators being produced by other industry partners. And the community and umbrella non-government organizations have organized and mobilized and are delivering or augmenting services and supplies to fill the gap that the public sector is feeling, often more to the most vulnerable communities in need. Next slide. So this is a picture in June 1st. These are the numbers, and often that's all we, back. The number, we look at the numbers and think, okay, we've got the full picture. This is the picture. All right, now let's move forward. So next slide. This is as of June 10th, so that was yesterday. So the numbers have increased, but once again, what's behind the numbers? So next slide. So what's behind the numbers is not just the blue blocks there, not just the healthcare system, although that's what we hear about mostly. What's going on in hospitals, what's going on in long-term care, and we don't hear much about anything else. But what we really need to understand is what's allowing that healthcare to function, and what's allowing healthcare to function are adequate human resources, and we've seen with the long-term care disaster, this has been a huge issue. Health financing and resource allocation, we see that once again with the way long-term care has been financed and where resources have been allocated. We also see in our public health response in terms of labs and surveillance, where our budgets have been flatlined for the last 5 or 6 years and prevented a surge capacity in the public health system. And in addition, for example, information systems, a vital part of the health system. We are looking at different elements communicating with each other: surveillance, healthcare, community testing. And the money in that area has not been allocated well over the last 5 to 10 years. And so once again, we're in a bit of a deficit, and we're scrambling to make all of these blocks work together. But let's not forget the pink block on the left, determinants of health framework. And sorry, that got a bit squeegee in the redo of the slides. This is what we mean when we talk about income, education, gender, racialization, all the things which determine our health, including the health system. And on the other side, the purple pillar, what are the policies that are having an impact on our health? Normally, and right now during COVID, in the transportation sector and security sector, trade sector, etc. And as Henry also talked about, as we all talked about, the role of non-government plural societies and the role of the public-private sector in terms of accountability. So all of this is involved in our response to the complexity of COVID. Next slide. So how are we doing? So we do need to look beyond the numbers. How are we measuring our outcomes? Are they just results, or do we know how effective what we're doing? How effective is what we're doing? Is this effectiveness equitably distributed amongst our populations here in Canada? And how are governments and implementing agency measuring and reporting success? Right now, it's usually the cases and deaths. But after the initial crisis, how are we going to look at this? And is it just the reduction of cases? What's behind those numbers, and who are those people that are reflecting those numbers? Next slide. So when we look at interventions, and for example with COVID, as interventions or treatments come into effect that we recognize may be working in the ideal research situation, we need to know how are the people doing at the tails of the curve? Why are they not responding to this treatment? Are they poor? Are they poorly educated? Are they marginalized? Are they racialized? And so we need to make sure that whatever we develop and whatever we distribute is fair and equitable. Next slide. So in Canada, we have had some varied responses by provincial governments. Next slide. And that's been reflected in the various trends in the different provinces. As I think Carol mentioned, Bonnie Henry is a medical officer of health for British Columbia and took early action, calm and determined action. And you can see those results in the trends in British Columbia, and where in Ontario and Quebec, the responses maybe weren't as early and quick, and we've seen increases that are still of concern, and in the Atlantic provinces, we're seeing that they're coming down quite nicely. Next slide. So one of the big issues in Canada that we've all heard about, and if you're from out of Canada, you need to know about it, is that we've failed. Go back to the, yes. We failed in terms of our older populations, our seniors, the ones that looked after us all our lives. So there's been a huge number of deaths in long-term care. Certainly limiting community transmission has protected seniors living at home because they are more vulnerable. But the way we managed it in long-term care was not stellar. British Columbia had an early ban in May 6th. But we did not have that ban until later, and that's been reflected in the deaths in Ontario and Quebec as of May 6th. Each province then had a response, and it's been very, very different, and the responses in terms of deaths have also been quite different. For example, Amica across Canada has had no deaths. Next slide. So the lessons learned is that we've got different Canadas. We've allowed its senior facilities to become killing fields. 82% of the cases have been the elderly. Another Canada is the systematic inequities. We've got a pandemic of racism. We also have another Canada, the outbreak about migrants, for example, in Ontario. And final slide. I won't do the hammer and the dance. We'll just move forward with the final slide. Keep going. So I have 1 minute left. And that is that we have to take a look, like Margaret said, of all the sectors, the need for coherence and collaboration. We need to understand what everybody's doing. Do we have water for people to wash hands? Do we have masks? What's going on in trade? What's going on in human rights? How are we dealing with healthcare? What's going on with our migrants? And so this is something that we really need to work on for the future. Thank you.
Thanks very much. I appreciate that. I appreciate that 10 minutes is challenging, and there's so much to cover in each of these presentations and some really interesting highlights. So I'd invite all our panelists to come back on with your video, please. We've got just short of 10 minutes for some discussion, and we've had some really interesting questions that have come in, some before actually the session was held, and some that have come in over the course of your talks. One of the questions that has come in has related to press. And some of you have highlighted the role of fake news, the role of journalists. So I guess I'd like to just have a comment from Henry about where do the journalists sit in this framework. And then I would like to ask Margaret and Carol and Jan just quickly to comment on the power and influence of the press. We've seen that in Canada with the data and the numbers. So if you could just comment a little bit on the role of journalism and the press in the COVID-19. So Henry, maybe just a quick response from you. Where does the press sit in your framework?
Well, you know, there's all kinds of press doing all kinds of things, so there's a lot of variability. One of the things I find ironic in personal experience trying to get published a particular angle on this is that the press is split between the press that totally lies and, you know, and doesn't worry about it at all. And you know some of the ones I'm talking about. The other side of the press, and the epidemiologists, I think, are part of this, is they're so careful about proper science that ideas are being blocked. And that's the experience I've had, where I've tried to convey something. I won't go into detail, but it's kind of like people are almost scared to attend. You know, I think Trump kind of spoiled things with his bleach, and the other. You know, the interesting thing about the medication that he's promoting is he gave it the kiss of death. I'm in touch with friends in France who know the guy who's proposing this, who's a very respected scientist, and yet it's kind of dismissed like it can't be right because it's Trump. So in a sense, the press has also gone the other way to some extent.
Yeah, I wonder if Margaret, you could comment a little bit on Ghana and the role that fake news has had, or if there's been any formal response to rumors that have come out in the public around this time.
Yeah, I think with social media, WhatsApp, all the different social media that we know about, a lot of information has passed through. So I think the coming in of the Ministry of Information to give the daily briefings and to correct misinformation has been quite helpful. And now you see a campaign where people are trying to put out what the correct information is and to dispel the fake news. You know, usually people would like to hold on to fake news. It's more exciting. But as much as possible, they are trying to give people the best kind of education and to put out the truth rather than the myths and the misconceptions. It will take some time. It's contributing even to the stigma. So people are being exposed and people are being stigmatized because they have the condition, and it's creating problems too.
Maybe just as a follow-on of that question with related to stigma, Jan, maybe you could just comment on, have we seen anything in Canada about stigma and inequity, you know, here in Canada in terms of our response to COVID-19?
Well, I think we have, and certainly the role of the press has been unprecedented, but it's kind of who do we trust? But the problem is it's been really inextricably linked to social media. And it's hard to extricate out when something's being reported. Where's the root? Where's the source of that, right? And so who do people trust? I think we're certainly, number one, we're seeing it with blaming the other. So blaming those people that have come from elsewhere and potentially not treating them as fairly. And then most recently today, we're seeing the way the physician in New Brunswick has been attacked for what was perceived to be irresponsible action on his behalf, but as it's been disclosed, probably not. And he's being told to go back to where he came from, the DRC. So I think certainly amongst migrants, there's inequity, and then amongst other vulnerable populations, newcomers to Canada, whether or not they've been here for a month or 5 years, sometimes there's a perception that they may be the ones, quote, bringing the disease or carrying the disease, but also that they can't communicate their needs, and we can't communicate always what needs to be done in terms of prevention.
So we've got just a minute, and that's always what happens in these things. I find there's so much rich content that gets communicated. I want to give Carol just about 20 seconds to comment on the gender. You highlighted domestic violence in your slides, and from your perspective as a gender specialist, if you could just give us a soundbite on how you see COVID and gender.
Well, I think it's interesting that I think my presentation was the only one that mentioned the Department of Women and Children, and I'm sure that this is taken into account in other countries as well, but this has been a really big issue for people left at home with violating partners. So I think that this is something we really need to pay attention to and report on as well, and give people access to phone lines to help as they are trying to do in Costa Rica.
So I'm gonna have to, I've just noticed the clock. I thought we'd have a little bit more time. There's quite a few really interesting questions which have come through the box, which unfortunately we don't have time for, relating also to the application of Henry's framework in emerging economies in Ghana, talking also about future lockdowns. Are we going to have more lockdowns in any of these countries with second waves, and just the anticipation of the future, which as we all try and understand where we're going to be in 3, 4, or 5 months from now. So I really want to thank our participants who put some really thoughtful questions into the box. And I want to thank each of our panelists for really giving us both a bird's eye view, but also detailed story and picture of the different country responses. And Henry for really challenging us to think about a new framework and approach. And when we look at the complexities of COVID and what it has done, upturned our society, we really do need a different way of looking at this, and we need a more comprehensive approach. So I would like to thank each of you for your presentation. Thank you to Bruyère Research Institute for coordinating this, to Caitlin, who's running the show behind the scenes. We really appreciate everyone's attention today and your contribution to making this a first very successful research talk. So we'll look forward to advertising our next one and hope that we may see you all in a couple weeks time. So Heidi, I don't know if there's anything from you, but from my end, thank you very much.
Thank you, Alison.
Thanks, Alison.
Thank you.
Thank you.
Thanks, everyone.
And Alison, we can answer the questions. You can send us questions and we can answer them after.
Yeah, I'd be happy to do that.
Do we have a minute for me to ask Margaret? I mean, we're offline, I assume, but do I have a minute to ask Margaret a question?
Yes,
Yeah,
of course.
Margaret, those cases in the south, you said the south and the 2 parts of Ghana, is there much pollution in that area, or is there much burning in that area?